Well, thousands of people who have UnitedHealthcare insurance could find many of the hospitals in Metairie, the West Bank, New Orleans East, and downtown out of financial reach if a contract dispute is not settled between LCMC Health soon. Thanks for joining us, everyone. I'm Sharice Gibson. So these negotiations over how much the hospitals will be reimbursed for services. Meg Farris joining us now live from University Medical Center with the very latest. Meg, can you break this down for us?
Sure, Sharice. So here's the thing. This contract dispute affects people who have UnitedHealthcare either through the Affordable Care Act on the exchange or from their employer. Now, it affects if you pay out of network when you go to an LCMC hospital. It does not affect doctor visits, even if the doctor's clinic is inside of the hospital. Now, LCMC says United wants to pay less than the cost of inflation by reimbursement, but United says their reimbursement is at market competitive rates. You may have noticed the two full-page ad in Sunday's newspaper, LCMC Health and dozens of doctors imploring UnitedHealthcare to come to a contract agreement.
We're far apart in the negotiations, and that being the case, as of November 1st, it's very likely that UnitedHealthcare will force LCMC Health hospitals and physicians out of network, denying access at an affordable rate.
LCMC runs 8 big hospitals in the metro area.
LCMC Health and Manning Family Children's in particular have been dealing with stagnant reimbursement for a very long time, despite rapidly rising costs.
We want to have an agreement with LCMC, but what we're doing is trying to protect the dollars of our employers, specifically our self-funded employers. We want to offer affordable, accessible care to our members in the New Orleans market. And we take that very seriously.
UnitedHealthcare is the second largest health insurance in Louisiana with 1 million clients. LCMC says this contract affects 30,000 patients. UnitedHealth says 70% of its Louisiana customers are insured through employee benefits.
So that would go directly to the bottom line of those businesses and significantly impact not only the businesses, but their employees as well.
The contention that this is somehow greed on our part. We are reimbursed currently at a much lower rate than our competitors across the region. And yet we take care of some of the most complex patients with the most serious medical problems. We are the lowest cost provider across the region.
LCMC says United is offering them a lower rate than its competitors.
And again, that's not accurate. According to our information, they would be paid competitively with the providers and the hospital systems in our market.
Now, this is very important if you have United and you're under some sort of long-term care. That would be like if you're expecting a baby. That would be if you're under cancer care. If there's no agreement by November 1st, look at the back of your ID card and call that number. And I want to read this name of this program, Continuity of Care Program. You're going to ask to set up a Continuity of Care Program. That way you can stay with that care and your doctor at the in-network cost and in-network copays. But you have to prearrange this before you go into the hospital. So stay tuned, see what happens by November 1st. Reporting live from UMC, Meg Farris, WWL, Louisiana.